I've been practicing medicine for over 25 years, and I've seen it. The world is hurting, people are sick, and even with our greatest scientific discoveries and technological breakthroughs, trends in health are not getting better. We weren't designed for this. This world as we know it, it's not our home. But there is a remedy. Our Creator designed us to be resilient creatures, and He's given us clues in the Scriptures that have dramatic implication for our lives today. Let's talk about biblical prescriptions. Let's take a serious look at living as God intended. Are you ready? Let's get well, and let's go home.
Welcome to the Biblical Prescriptions for Life podcast. I'm your host, Nick Evanson, here with Dr. James Markham, and we're going to share with you today about biblical prescriptions and how you can apply them to live more in harmony with God's design for your life. This week, we're going to talk about how to speak with your doctor and make the most of your visit every time you see a medical professional. The advice you hear on this podcast is not intended to replace the care of your primary physician, and before changing your healthcare regimen, please consult with your doctor and really work with them. Dr. Markham, thanks so much for joining us, and how are you doing today?
My pleasure, Nick. And after last week's podcast, I got some recommendations to maybe make it a little shorter. I got long-winded last time, but diabetes is a big topic. But hopefully today's topic on how to speak with your doctor will be a little bit shorter and it'll be more to the point.
So just a quick little bit of banter here. What's going on in your life this week? How are your dogs doing?
Well, my dogs, if you hear some whining, they're outside our radio studio wanting to join Daddy. Okay, and if people don't know, my dogs are named Max and Daff, and I just really love my dogs.
And they really love you.
Yeah, when I come home, they're right there with me. They follow me around, usually to when I go to bed. When I'm working on something, they sit at my feet, and I think the dog lovers out there can appreciate that. But animals are a biblical prescription for life, because for many people, animals give them something to love. It makes your endorphins, chemicals called oxytocin, go up. It helps relax you if you've had some stressful days. Dogs usually don't talk back. They give unconditional love.
That's right.
They'll lick you if you like that kind of stuff, and they just do all sorts of good things. So I really, really like my two dogs.
I just remember they made an appearance on a recent episode of the podcast, so I thought our listeners would like an update on how they're doing.
Yes, and they're doing good. And if you hear them, that's where they're at. They're wanting to come in, but we decided not to let them jump on us. So if you're a dog lover, we want to hear from you. If you're not dog lover, well, save your comments.
That's right. And if you do have comments on anything that we discuss in this podcast or just general questions you may have, go to biblicalprescriptions.com/podcast, and you can leave your comments, questions there, and we'll try and get to them on a future podcast. And Dr. Markham, we're talking about how to talk with your doctor, but before we do that, I want to hear from you. What is your favorite healing story from the Scriptures?
Oh, wow, Nick. There's so many stories that I think out there, but one of my most favorite one is where there was sort of like two healings at once, okay? Remember the story in the Bible where Christ was going to heal Jairus' daughter. Remember that story? And he was walking to heal her. That was where he's going. She was about 12 years old at the time.
Right.
And at the same time, there was also another woman that had been afflicted with an illness for 12 years. She was bleeding, probably some type of female problem. She didn't know where to go. And can you imagine that poor lady, what she'd been through, in that age? She was considered unclean because she was bleeding. She probably didn't have a husband. She probably couldn't worship at the tabernacle. She was probably ostracized by people. She's probably fairly young if you think about it, because he was still, bleeding. But this has been going on for 12 years. And yet Christ was going to heal someone else. And during all this rush, she says, I have the faith. If I can just touch him, I'm going to be healed. So why Christ touches her, she's healed.
Well, she touched the hem of his garment, right?
And she's healed.
That's right.
So it's fascinating is because Christ is not only heals her, but he's also going to heal this 12-year-old girl too. And he goes later on in that same day and he heals her. But in the process of healing, he lets us know that this is more than healing. He's about being a part of their lives. As soon as he healed the 12-year-old, he said to her, here, let me have some food. Get up and start living again. And most of the healings in the body, after the people were healed, he helped them get better. They wanted to tell people about him. Look what's happened. Look what he's done for me. And so this is one of my favorites because there was 2 healings all at the same time. 12 years of affliction, 12-year-old, many parallels that go involved. But Christ has had so many wonderful miracles in the Bible through healing the body. And yet, he met someone's need, and then he got at their heart and introduced them to a relationship with the Heavenly Father. That's what he was interested in. And that's why the physical and the spiritual go so much together. And that's why at HeartWise, we like to let people know that the real true physician is Christ. He's the one that does ultimate healing. But along the way, he can teach us how to take care of our bodies better, lead us to different people that can help us, to coach us, that can pray for us, that can help us grow in this walk.
Yeah, and that's what the Biblical Prescriptions for Life study is all about. If you're listening to this podcast and you haven't heard about the Bible study, if this is your first podcast that you've tuned into, go to biblicalprescriptions.com. There's some short videos you can watch. There's information if you want to lead a study. Just go to biblicalprescriptions.com and check it out. We're all about pointing people towards Christ and the restoring relationship that he wants to have with you and give you eternal healing, as well as provide some simple solutions that may relieve immediate health issues in your life as well.
Well said.
Well, thank you, Dr. Markham. Well, let's talk about interacting with your doctor.
Yeah.
Sometimes, it's a huge investment. Medical expenses in this country are out of control. How do we make the most of it when we go to see our healthcare provider?
Well, first of all, I want to let everyone know that things have changed. The most common thing that I notice is the only thing that's constant is change. I had to relearn almost everything I learned when I graduated from medical school in 1991, including not only what I've learned about medicine, but even how to relate to patients. It changes. And it's going to change in the future. In the old days, we used to have tons of time to talk to patients. Yeah. So your time wasn't so cramped. But nowadays, a doctor's visit might only be 10 to 15 minutes. And of those 10 to 15 minutes, a lot of that might be gathering information, putting things on computer, all sorts of things that take up part of that time. So in order to get a really good relationship, a couple things. I like patients to understand, sit in the doctor's seat, okay? The doctor is seeing 32, maybe more patients per day. Sometimes he's tired. Sometimes he's been up all night. Sometimes if he goes long in the day, he misses the chance of being with his family and his friends and doing other things. Yeah. He's given up a lot of time already just to get trained to where he's at. For instance, I give up my 20s. I didn't go out and play ball and do all those fun things in the 20s. I studied and went through, fellowship in medical school. Now, I don't want people to feel sorry for it because it's a calling. Yeah. But if you can understand where they've been, that might help you relate a little bit better. So the first thing you want to know is how does your doctor hold up to all that? And, you want to know who you're going in to talk to before you go in to talk to. And the way you do that is talk to friends, relatives. There's lots of sites on the website. You can sort of get to know your doctors, whether they're board certified as well as the providers. Sometimes you don't see a doctor, you see a provider now.
Yeah, let's talk about that. Who are the different staff that you might encounter going to the hospital? You
might see a nurse practitioner. You might see a physician's assistant. In some practices, you don't really see the doctor at all. And he just supervises someone's charts.
Now, is that something you should be concerned about? I know sometimes if you're not seeing the doctor, you might think, I'm not getting my money's worth.
But some people would rather be seen quick and get into those type of practice. Some of the problems aren't that involved. And sometimes it can be supervised. Some types, some practices, every patient is seen by a doctor. My practice, I see everybody. But because I see everybody, sometimes I have to be shorter with some, longer with others. You have to really use your time wisely.
So the nurse practitioners and the physician assistants, those guys, they're under the doctor's supervision most of the time.
All of the time.
And they're definitely specifically trained to do the role that the doctor is having them do.
Right.
So most of the time you can be fairly confident, I would assume.
But we didn't even have that when I first started. So sometimes a doctor is supervising nurse practitioners. So in that case, if you choose a physician who has great knowledge, you want to make sure he has good nurse practitioners that he's helping guide. So that would be important in that type of practice. But you want to research the practice, talk to your friends and neighbors, and decide, well, would you be happy to have maybe greater access with the nurse practitioner and more time? Or would you want to really see the doctor, maybe have less time or whatever, because the practices are changing.
Yeah.
So you want to know what you're getting into up front. You want to know the doctor. Does he have the qualifications you want? Sometimes it's important to patients to have doctors that relate to them in certain ways, and it might be belief systems. Sometimes that's important. The way they handle themselves. Some people like more conservative people. Some type more liberal. So if you can match your personality and your ideas with the doctor, that helps. Ask a lot of questions. So sort of know the person before you go in there. Sort of have a feel for their philosophies if possible. You can go to the websites, look some things up. Some now times practices have full websites that talks about credentials. I had one patient that came to see me just because I went to the University of Texas and they were from Texas.
Well, there you go.
That's how they felt like they had a bond there.
Yeah.
So people come. A lot of people come because they might hear something you've written or said or how you've interacted with other people. But word of mouth is probably the best way to go and find a practitioner. So not only do you know a lot about them, but you also realize that this is a partnership. It's just not a one-way street. Realize that the physician is there to help you and to help you heal yourself the best way possible. Now, I try to include the spiritual component. A lot of doctors don't do that. I try to give the patients the ability to do things naturally when safe and possible. I also try to give them the education when I can, knowing that I have a certain amount of time. I also try to give them websites and others where they can be in control, where they can actually, I don't have time to talk about a lot of diets and sometimes, so I give them resources that they can go to so they can change their own chemistry.
You give them some homework so they can educate themselves further on the matter.
Right. And every doctor is different. And that's why you have to do your homework and see. So once you're in the room, okay, you want to come prepared. If you're on medications, you want to have your medications. Most practices ask for all your records so they can review the pertinent records. And the nurses enter that into the chart. Sometimes the doctor comes already knowing that. So when they come in, they have all that information. They can say, listen, what is the problem? So one of the things, some patients like a doctor just to tell them what to do, take some medicines and not make any changes. So if you want that type, you need to know about that. Some people like doctors that will give them all the options and explain everything in detail. Well, that's important too. So it's really, you try to match your personality with their personality, their style with your style, realizing that it's not a perfect world.
Yeah.
So you go in there prepared, and then you want to have the most important things that bothering you. You want to say that right up front.
So I want to go back to the preparation part of it. With so much information on the internet, people can go and Google it and try and narrow down what they have ahead of time. Is that something that's helpful?
Well, not to me very often, because people unfortunately, the internet focuses on the things that are less common and sometimes not on the things that are most common. So someone might go in with a headache and they might say, well, I think I have an astrocytoma in my brain. And I said, well, it might be because you banged your head on the wall just 5 minutes ago.
Yeah.
You see what I'm saying?
Yeah.
So the doctors who've done this years and years sort of focus on, they manage risk. They know what's happened before. They know what's most prevalent. So they know sort of where to guide the discussion a little bit.
So try to diagnose yourself at home before you go to the doctor, not necessarily the best idea.
No, but at the same time, you want to have some common knowledge about what are things that I should go to the hospital with. Pain that won't go away, can't breathe, dizzy, passing out. Those are things you want to go to the hospital with. You don't want to, I'm going to wait till next Tuesday to see my doctor. So it's good to have knowledge, but apply it appropriately. And that's what we try to do through this website, is give people knowledge that they can apply appropriately.
Going in and telling your doctor during your first visit what you have probably isn't necessarily the right foot to start off on.
Or even what you think they should do. or what medicines they prescribe. Because when you do that, well, why are you seeing them?
Yeah.
You want their expertise and their knowledge base, even though it might not be what you necessarily want to do. Because you remember, you're and I do this all the time, Nick. People will come in, they don't want to hear this. They want to hear, well, you're really short of breath, but it help yourself a lot if you could quit smoking, things like that. They don't want to hear that. You have extra weight. Well, this is something you have to do. I want to give you the steps to do this, but some people don't want that approach. Some people just, well, give me a medicine, I'll live the way I want to do and go on.
Right.
And it matches your personality with that. But the more prepared you are, the more valuable the meeting is. And usually the doctor will say, well, why are you here? What can I help you with? Now, he already sort of has a feeling with that. And then you'll explain, and then the doctor hopefully will listen and guide you in the conversation. And then at that point, he'll say, well, these are the symptoms you're having. These are the things it could be. This is how we can sort through it so we can come through a treatment plan.
Now, I imagine it might be helpful as a patient if I'm experiencing symptoms that kind of come and go to document that at home. If I can remember Wednesday this happened, and then Thursday morning it happened again, and then Sunday afternoon it happened again, it would be helpful to see annotated
the more
symptoms.
Specific information you can have, the more information they can process, and they can sort of sort through, well, what's relevant and not relevant, what's something that applies to this. But if you can just have the symptoms that you're most concerned about first. Now, sometimes they'll go to the doctor with 14 different things. My chest hurts, my nose hurts, my ear hurts, my hair hurts. That's way too much information on the first. Well, let's just focus on one thing. Now, there'll be some visits where you'll just focus on preventing things from happening. So the visits have different types of meaning, but usually you go to the doctor with just one type of symptom, and hopefully the doctor will not only help you with that symptom, but show you ways to not have symptoms in the first place. Also educate you on what's important and what's not important so you guys can grow. And remember, it's a relationship. And, if the relationship doesn't work out, or you go in there and you say, man, I just don't feel good about it. This is something I'm not comfortable with. Or the doctor feels the same way. Well, there's no harm. No one's going to get offended if you say, no, I'm going to go somewhere else for my care. And sometimes I've done that with patients. If it's someone I don't think I can work with, it's someone I know it's going to frustrate both of us. I say, listen, nothing personal, but I just don't think this is a good match. Why don't you sort of find someone else that is more in line with what your healthcare beliefs and needs are. And the people that I have problems with is people that don't want to listen, and they want to follow directions, and they just want to do whatever they want.
They want to do their own thing.
Yeah, so they don't really need my services. They need to find someone that would go along with what they would want to do. So some take-home points is, do your research before you choose a doctor. Now, sometimes you can't do that if you have insurance plans that don't let you do that.
Right.
Then you might have to choose insurance plans that gives you the most flexibility. Okay. 2, try to understand ways you can stay out of trouble so you don't have to see the doctor as much in the first place.
Yep, prevention at home as much as possible.
Ask your friends and relatives who might be really good fit for you and if they've had a good experience.
Ask for recommendations.
Yes. Go to the internet and find out what you can about a practice. The practice policies are sometimes important too. If you can't live with the financial policies or the when the doctor's available policies, or who will actually be seeing you that day policy.
Right.
That might, or where the tests are ordered, or which hospitals the doctors use. That might be a game changer. Like, they might like the doctor, but they don't like the hospital that the doctor uses.
Yeah.
Those type of variables, that might be important. When you do go to the visit, go prepared, have your medical records, have a list of the questions, go realizing that the doctor is a person too. He has a busy schedule, he has his limitations, and he's going to work with you, he or she, as quick as they can to find out the answers and move to the next place. They don't necessarily have a lot of time to chit-chat. Now, when they do, they'll take it with you. But, if you're seeing a boatload of patients every day and have to do a bunch of dictations, sometimes you have to, spend more time with the people that need it the most.
Yeah.
And sometimes the patients understand that. Yeah, I'm feeling great today. I'm here just to get my medicines refilled. That's going to take 5 minutes and I'm going to be done. In and out. I don't have any problems. I know all this. Then some other patients say, listen, since I last came in, I've had this, and this, and I need to talk about this. I'm having some problems. And that person, the doctor is going to have to spend more time on, realizing that all of these complexities exist. Those are just some simple places to start. We could go on and on about this, but really this is something that you need to think about in great detail, because that relationship with your doctor might go through some of the toughest situations in life. Divorces, deaths, dangerous things in the hospital, fears, spiritual things, all sorts of things that we go through with the patients. And after you've been practicing for 20, 30 years, you've seen the gamut of people change. I've seen people age in front of my eyes over 20 years. I've seen people that were very active become people that they don't even know their name anymore. And family dynamics are all very important. So find someone that you're comfortable with.
So it sounds like the ideal doctor-patient relationship looks something like this. The patient has done their research, got recommendations. They've tried to prevent disease at home, but then they've got to come see a doctor. So they come and see you and they sit down, don't try and tell you what they have. They just try and tell you what they're feeling. They don't self-diagnose necessarily, but they tell you what's going on in their lives. And then you're able to prescribe life changes.
First, make a diagnosis.
You make a diagnosis, right? And then you educate and possibly medicate when necessary, right?
But but there's many different variables. But I think word of mouth is important. Coming prepared, knowing who you're talking to. Whether your ideas align with the doctor that you're working with. But I say the most important aspect of working with the doctor and choosing to the very last, and that is this. That's a biblical prescription. In all thy ways, acknowledge him, and he shall direct thy paths. If you think about that, is God, Christ, wants to be a part of every decision. So acknowledge Christ and let him direct your paths and who you choose. Pray about it. In James 1, if any of you lack wisdom, let him ask. So Christ, your best friend, wants to be a part of every decision, even if you think it's not a big decision. It doesn't bother him. He wants to be here with you and guide you and lead you. Christ has always just wanted to be with us. Why would the God of the universe go to such great depths if he didn't want to have a relationship with us?
Right.
And, I don't know about your wife, but my wife likes to, know a little bit of everything about what I'm doing.
Yeah, you bet.
And your best friend wants to know. And if you're going to choose a doctor who's going to guide and direct your thoughts in your life, you're going to want to ask your best friends, hey, listen, I acknowledge you. Please direct my paths. I lack wisdom on this. Please help me. So despite all the things we talked about in our discussion, and they're relevant, I want everyone here to ask God to direct your path when it comes to choosing a physician that will help guide you basically through health and life.
Yeah. This isn't necessarily a discussion that people probably think about a whole lot sometimes, but making the most of each visit with both your physician here on earth and every meeting with our great physician, our Father Christ in heaven. It's important to really think about these things and spend the proper care to communicate well what's going on in our lives and who we want to serve and how we want to live.
That's right.
Yeah. Well, Dr. Markham, thank you for sharing with us.
My pleasure.
It's a perspective that we don't often get to hear. Not everybody has this relationship with their doctor that you and I have, which I really appreciate. And we hope this has been a useful conversation for those listening. And we're going to go ahead and wrap it up here. But if you have any comments, we want you to go to our website, biblicalprescriptions.com/podcast. And you can ask your questions, leave comments, and we'll try and address those in a future podcast. So find us on the web at biblicalprescriptions.com/podcast. And if you also would do us a favor, if you appreciate this podcast, leave us a review on iTunes or on YouTube, Stitcher, SoundCloud, wherever you're listening. We want you to leave a review. That'll help other people find this podcast and just grow the listener base and help more people find out about biblical prescriptions for life. Thanks so much, and join us again next week where we'll discuss more about getting well and going home.